we quickly march and jump into our next set of panel discussion, which is on roadmap to medical tourism for urban, rural, small and large hospitals. We enhance and understand the medical and wellness tourism in our country, India. We would like to begin by inviting our moderator for the session over here. I welcome and invite Akhil Daveji, the founder chairman, AHMP India, to please join us.
We are in between of a lunch, right? Guys, do you know what is medical tourism is? Come on here, Akhil, ये क्या बात कर रहा है? This is everybody knows, right? Hello, hello. Are you aware about medical tourism? Are you aware about medical tourism? Come on यार, yes तो बोल दो please. यार हम लोग गुजराती है यार, हाँ तो बोलो मेडिकल टूरिज्म खबर છે એટલે મેડિકલ ટુરિઝમ ને ખબર છે બીજા એક વર્ડમાં શું કહેવાય એટલે બીજો પણ એક વર્ડ છે એના માટે એટલે આપણા બધા ગુજરાતીઓ તો આવતા જ હોય યુએસ યુકે ઓસ્ટ્રેલિયા એ બધાથી તો આવતા જ હોય આફ્રિકન્સ પણ આવતા હોય એટલે એક એનઆરજીસ હોય એક એનઆરઆઈ હોય પણ એક બીજો પણ એક terms say આપણે healthcare owners right we are into the healthcare professions and we know that what we mean it like we call it a different term also for a medical tourism. How many of you know about it? I am just doing a time pass while they are arranging things. That is called medical value travel. Come on yaar, we are healthcare owners. So anyways, it is a very interesting subject we are talking about, and because we are running late, so we'll be little doing merging up this thing, a quick things we'll be doing it. So we are talking about the roadmap to medical tourism, urban, rural, small hospitals and big hospitals, and we have with us to discuss this thing amazing the experts into it. I'll call upon the first, Dr. Bharat Modi sir, to be on a stage. He's an entrepreneur, he's an amazing, well-experienced, well-renowned orthopedic surgeon and the owner and director of Wellcare Hospital, Vadodara. Second, we have our own Dr. Sumit Kapadia. He's kind of, vascular surgeon, renowned vascular surgeon, branding experts and director Aadicura Super Speciality Hospital. Next, we have Shahid Parvez. He is heading the healthcare operations and the entire international business of Apollo Hospital. Then we have Himanshu Sharma sir. He is specialized in strategic healthcare business development and business relation officer at KD Hospital. And these are the stalwarts of I can say they had established healthcare businesses as well as the medical tourism, when it's called a medical value travel into the Gujarat particularly. And I'll not take much time. Straight away we'll go to the next question because we are running out of time. So Shahid Parvez sir. Yeah, settle down. Okay. So obviously you are into this business of international business and everything, and you are being connected with Apollo Hospital. This is one of the flagship hospital who is established medical tourism value into the Gujarat. So considering the diverse need of domestic and international patients, how does Apollo Hospital tailor its services to enhance the medical tourism and how they enhance the experience over here?
Thank you very much. Let me begin this way because the forum is that rural and urban medical tourism. And Apollo started this journey 40 years back. And today we have been catering and we have been treating patients from across the country, 140 countries coming to Apollo ecosystem. So the way it's developed, it took 40 years to establish these things. Millions of peoples and $1 billion industry. But this is still, we are far to go in medical tourism. I'll just give you an example. Once it started that time in India, our chairman in the family, he was in need of healthcare during that time, and it was not available in India. That time he traveled to US, treatment given there, but somehow could not save the life. From there, our chairman thought, let us start something healthcare in India. So that was the journey started 40 years back, and today we are having more than 74 hospitals, diagnostics, pharmacies, telemedicines, everything into it to cater across the things. And there was a beautiful, sometimes back, one American came to India for the treatment because locally they have been not being advised, is not going to save the lives and all. They searched Google and all, they connected to Apollo and then came to in Madras in Chennai from US sometime back. So that kind of, that journey, we used to travel to other countries for the treatment that time. Now people are coming to us. The kind of India is being seen. And of course, truly our Prime Minister has brought India in the global map today. So the visibility of India and in healthcare, if you see today, the kind of care, the infrastructure, the connectivity, because each country's, each zones is having a different culture. So you have to understand there and deliver according to that. If the people are traveling from Middle East, people are traveling from Africa, people are traveling from US and UK and Europe. So it is different. You have to prepare that way your infrastructure, your team, your nursing. And in Apollo, the culture of full-time consultants, they have been into the in-house. So those things, we are promising outside what we are delivering. So that sort of connect with the medical tourism. If you say like in urban today also you are saying and rural, people are traveling to rural places for the alternate medicines these days. Even the people got the treatment in bigger cities. But post-surgeries, they sometimes prefer to go in the rural places because the healing process is much better. Cleaner environments, clean airs, and multiple things are there, you can get it. So rural and urban is a good combination, so we can together promote the medical tourism in a much better way.
Thank you, thanks Akhil. Himanshu ji, like you already have an experience and everything. You do a lot of strategic planning for bringing the patients for here into the Gujarat. What do you think? What influence international patients, particularly if we'll talk about the medical value travel? What influence this international patients to choose the Indian hospitals?
Thank you, Mr. Akhil, and thank you, the HOCON team, for organizing such a great event. When it comes to medical value travel, actually medical tourism per se, when we look at Indian perspective, I personally believe is a misnomer because majority of the people who are traveling to India, especially when we talk about states like Gujarat, probably Kerala could be an exception where people would come or travel for tourism as well as health. But in our case, a major chunk of people who travel primarily travel for health reasons. That's why I put it across as medical value travel and not medical tourism. For anyone who's in their own comfort of our country, like all of us here, we are in a comfort zone because we know that anything small or big happens to us. We will not have to travel, maybe when it comes to Ahmedabad, maybe 10, 12 kilometers before we get a solution to our healthcare issues. It is not the situation in majority of the African subcontinent, Central Asia. So these are the two parts of the world from where we get maximum number of people who seek treatment out of their comfort zone. So medical value travel is nothing but when a patient is willing to seek treatment out of their comfort zone, traveling beyond the continent and seeking medical care, that is what we term it as medical value travel. Now, why do they opt out? Like, I've been into medical value travel system for almost 17 years now, and I understand that there are three basic reasons why anybody would like to opt for traveling outside their comfort zone, outside their country, to a place which is unknown. In fact, majority of the people who come for treatment to India are usually first-time travelers, majority of them. So first and foremost is the availability of the services. So just to cite an example so things become slightly clear to all of you, let's talk about for example, Yemen. We were discussing that before so in a country like Yemen, if somebody is having symptoms of some kind of a cancer, obviously what is the maximum possible investigation available there is going to be probably a CT with contrast and a biopsy. Beyond that, you'll not be able to do anything more than that. So when the treatment is not available at all, but the patient knows that, okay, I have to save my life, the family knows that they have to save their life, the only reason that stays away is that they will need to have the staging of the cancer done. They would need to figure out what are the chemotherapy medication, etc., which is going to work on them. So only reason that stays is they will have to opt out and travel outside their country. And in majority of the cases, India is the preferred destination for them. I'm coming to the reason why. The second aspect of it is, I've already mentioned about the availability aspect. The other aspect of it is the trust in the system, the advancements which are there. So taking example of IVF. Now there is a fair amount of possibility that in countries like Ethiopia, which obviously add a lot of commerce, a lot of value to the Indian healthcare system, a lot of people travel. There are patients who travel for IVF treatments all the way to India. It is available there. The treatments are available there, but the reason that people have more trust in the advancements which is available in India, that's why they opt to travel here. And the third comes the affordability aspect, which is a huge chunk. Now, I recently had a patient for Cameroon who wanted to undergo a CRTD therapy, and the services are available. Like, they could have traveled to South Africa, they could have got it done. The travel time is less. It's relatively less complicated for them because of the visa and other legal understandings. But he opted to travel to Ahmedabad and get the treatment done for a simple reason that the costs are much less as compared to what is there in South Africa. So these are three primary reasons that basically add the value to the Indian healthcare system when people from outside come over and gain access to us and, you know, spread a good word about our healthcare system.
Thank you, thank you. Coming next to the Bharat Modi sir, I'm sure, like, kind of facilities and everything, the strategy and everything comes, but when patient comes to in the hospital, I'm sure that kind of, there must be some challenges and at the same time opportunities also to providing a high quality, care to this kind of patients to our hospitals, like be it is a small hospital or a big hospital, urban or rural. So what's your thought on it?
Thank you so much. I compliment the organizers for such a immensely well-organized conference. Medical tourism has turned into, to some extent, a bit of a buzzword. Let's get to the right perspective. The cake is still the 1.4 billion Indians which we have in this country of ours. The icing could be the medical tourism. Medical tourism, I have been in this business for 30 years now. And one way or the other, I have been fortunate enough to be to be one of the beneficiaries of medical tourism from a perspective of not only establishing my stature as a surgeon, but also the commercial part of healthcare activity. We can broadly classify medical tourism into two segments. One is the value seekers. The value seekers being, as Himanshu just mentioned, people who find attractive price point. They are genuinely in trouble in terms of their finances. They don't have locally available medical expertise, and therefore they need to go out of their country. And these value seekers, typically, for example, from the countries of Africa or some other countries like Yemen, which was, again, despite being in the Middle Eastern region, it is an impoverished country. The true destiny of medical tourism that India can certainly offer as an opportunity, because being a surgeon myself, I know that we have surgical and medical expertise second to none in the world, second to none. The only problem that we have as a country is, as those who might have seen that famous Hollywood movie, Forrest Gump, we are a mixed box of chocolates. Right. You don't know whether you'll get a sweet or a bitter one the next time you dip into. So first and foremost, we need to standardize. We need to create our image as a country and as a society that we are high-end delivery people and not just a motley mix of variable standards. We are certainly reaching there. this conference and this panelist discussion is a sign of the times. We would not have imagined this sort of a discussion going back 25 or 30 years, you know. So we are certainly reaching there. The opportunity is huge. The challenge is also huge. We are nowhere near where we can go into the high value, high margin added,
Right.
both in terms of the technology and the clientele.
Agree, absolutely. So thank you, Bharat sir. At the same time, when it's talk about like opportunity and kind of a problem statements and everything, what do you think, Dr. Sumit Kapadia sir, being into the entrepreneurial journey and being into the expert into the branding, healthcare branding per se, and being a good vascular surgeon, what do you think? Do you think that kind of a branding, we really need to work on our brand India or say brand Bharat? We really need to work on our healthcare, providing like hospital or a clinic or standalone hospitals. So what role really matters when it comes to a medical tourism?
So thank you for this opportunity, and yes, it's a great event for interaction, learning from all of us. When we talk of branding perspective, medical value travel, we essentially would divide it into three. It's about the international tourism that we all are focused on, but that's not the only one. The other component is on a national level scale, which would be beyond the state that currently the urban or rural hospital is. There is a large catchment area where it is relatively simpler to get those patients, especially for certain niche treatments which are not easily available there. So that's another opportunity where hospitals can look forward to. And the third is again something which most of the hospitals here have been doing, is reaching out regionally as well. So beyond your city into different parts of the state. So we would essentially think that medical value travel would be broadly into these three categories. And from a branding perspective, regionally and possibly on an interstate level, a presence on ground will make a big difference. For internationally, having presence there would obviously make a big difference, but it's the digital marketing which has probably changed the scenario and would make it easy for most of us to really reach out to these avenues.
Thank you, sir. And I'm sure when it comes to a marketing and when it comes to a innovative marketing, I think we have with us Shahid sir. So Shahid sir, you are the best person to enlighten us that what are the innovative marketing strategy at Apollo, like, you are doing that, which really brings a lot of patients, medical tourism patients.
Yeah, good. So, I quickly say like a few things. One is that connectivity. The connectivity in terms of the countries where you are targeting, where the healthcare is less developed, where the need, and how you collaborate with those countries in multiple ways, and the government connections, facilitators, opinion leaders, all those communities you have to identify, the target, the countries, and the connect. And then comes to your connectivity with the heirs. If in Gujarat, we are sitting in the Gujarat, we are sitting in the Mumbai, we are sitting in Delhi. So all connectivity from these developing countries where the healthcare is not so developed. Some limitations in Gujarat at the moment, but definitely it is improving it. During one of the sessions in annual sessions, it happens every twice, once in 2 years. That is what is the Mahatma Mandirs happens, right? So these sessions happen. So we had one Africa Day. So all African nationalists has been called in that forum, and we discussed government and private, say let's say standards, some sort of standard of care. You have to identify the people are coming from abroad to India. They take away the faces of India, how you treat, how you given that feedbacks. So those things we have a forum where the governments and the privates, we have been, but it didn't went so long for particular that sessions only created, so we did well. So let us, if you really want to develop Gujarat as a hub for the medical tourism, we have resources, we have potentials, but how we can align and how we can do it together. Everybody is doing their own way, they are going fast. But if really you want to go far, let us unite do the expertise and take the best practices from each other. And that is the way we can develop these things. Because we know better, I mean, the culture, the cuisines, the care, and affordability, and ethical practice, of course, in terms of treatment, in terms of pricing. So those things, if you have, the people are coming to you in the trust, whether we are delivering the same way. We cannot do everything under our expertise. Everybody is having expertise. How you select and how you connect. We have to present very, very wisely. Internationally, if we are going to present the India, we are not representing only one aspect. But that way we create the India. If the people are coming to us, definitely they have multiple options to go. Get the best treatments. Everyone has big markets. Everyone get the big share. But has to be very, very ethical and transparent.
Agree. Himanshu sir, what do you think, while we are talking about the marketing strategy and everything, what are the complexity of a ethical consideration? Like, nowadays we are talking about so many ethical things. So what are the complexity and logistical issues you find?
I deal primarily with the African population. So they have a phrase called as Sao Bana. I understand a bit of Swahili as well. So it means hearing someone out. So Indian per se, when I look at, I also have few connections in Turkey and Iran, which are fast developing destinations for medical tourism. Iran, in spite of not being so favorable, still people do travel. Now the basic difference between us and them lies in the people speak the same language of commerce. When I say that the government is making efforts in standardizing the costs, as Sir rightly mentioned, that you have an X-ray of the knee and somebody has advised that you need a total knee replacement. A patient in Africa would have access to at least 15, 20, 100 different things. And online, everything is available now. They would get in touch with. But ethical counseling is one thing, which is something which is extremely important. And we don't stand very high on those standards as of now. So at KD Hospital, I am personally trying, and not just here, in my healthcare career with Zydus as well, we have tried to figure out that we follow the 3 C's, in which we talk about connecting with the family, we talk about counseling, and we talk about care. So care before commerce has been my personal motto. That is, even if you are able to guide a patient properly, because when people from outside the country are traveling, as I spoke about comfort zone earlier in the talk, so it is very easy for us to say, okay, you come over for treatment, this is the quotation, this is what we will arrange. But understand, keep yourself in their shoes and figure out it is not very easy. So it is better to give them, as we are talking about a path, it is important to give them a path which actually tells them the risk factors, which tells them we should make an effort of engaging their local doctors in treatment, because when they are back home in their country, their follow-up would become easier. And as a hospital, we'll be able to add a better network to it. So it is not just limited to the commercial value of the transaction of what a patient is paying to you. It is about the value which we are adding to the society at large when we are dealing with people outside the country. So medical value travel is, as of now, just looked at. People talk about volumes. I mean, we almost treated 7.3 million international patients in 2023. Now, that is almost equivalent to the population of Ahmedabad. Yeah. But we do not talk about quality delivered. We do not talk about, when it comes to brand and communication, hospitals talk, everybody talks about we are excellent. Now, if everybody is excellent, then how does a patient choose? There is no pragmatic understanding, there is no fathomable manner in which you can choose a hospital. So there have to be guidelines, it is necessary. Like one interesting thing which the government of India has done now is that you have online visa applications which are now being made mandatory. Same way the quotations which are provided by the hospitals, they cannot be a variance of 200%. So if we really want to develop, we have to understand, when we talk about ethics, that is something we have to work on a package-focused approach. I mean, Bharat Modi sir would be the best person to comment
absolutely.
on that.
I was coming to him only that, when we are talking about the value and everything. So what do you think? Patient satisfaction is obviously the important aspects into the medical tourism. So how, as a healthcare provider, a kind of a hospital, we can improvise on that thing, that aspects, patient satisfaction. If we can quickly...
So if I understood your question rightly, you are saying how can we add to this
value,
the value for the customer?
Absolutely.
So I think a typical, the 2 or 3 things that I can bring home is, one is, of course, create a system which is dependable in terms of the results that it will give out to the international audience. And I'm referring to the international medical tourism, not the domestic medical tourism, which is also a very important aspect of healthcare business. But in international medical tourism, number one, it starts at the country level, wherein the first interaction that a potential customer has should be friendly enough in terms of the visa availability that Himanshu has sort of mentioned. Then it comes to the ability of the target hospital which the potential customer is approaching. Let's say if it is Wellcare hospital, my team at Wellcare should be capable of responding sensibly. We are lucky that in India, English is certainly our second language. And that at least that is a fantastic redeeming aspect. And that's why countries like China are not able to compete with us. However, a tiny country like Thailand does multiple times more medical tourism than a massive country like India. So we can add value by offering comfort at the ground level once they arrive at our place, before they even start their journey, and through the journey pathway, which means easy accessibility. Once they come to us, the way in which I have learned as a homegrown entrepreneur is that if you are able to provide that sweet spot of good medical results combined with looking after, strictly speaking, non-medical aspects like language, food and cultural aspects, and allow them to get that homely sense which is intuitive to the Indians. See, the Europeans, the Americans, it is not possible for these people to have the same sort of warmth, you know, and that's an extreme, and you cannot, they are handicapped. They can never cultivate that because it is part of a cultural trait. And સંસ્કૃતિ ઊભી કરવી એટલે સદીઓ લઈ લેતી હોય છે. So we can leverage on these aspects that we have as Indians. And I think, as I told you in my first round of answer, that there is a humongous opportunity here.
Absolutely.
Still, it is icing on the cake, but yet that icing is a thick layer of icing. And we should be...
Absolutely. While we are talking about the opportunity and all those things, Sumit sir, do you think there is a pros and cons of a medical tourism? Maybe, like, you know, there must be, if you can just quickly summarize on that thing, that pros and cons of a medical tourism. Why not? When we are finding the path, at the same time, we need to see the pros and cons also.
So in terms of our experience at Aadicura, you know, we would have close to 1% of our indoor patients would be from international tourism. That's quite a small number, but for a relatively smaller place, that I think is decent, and we hope the numbers go high. In terms of the advantages that you know, they get from a patient perspective or a client perspective is primarily the 2 C's. It's the cost and the care. So from what all of our panel members said, that the care which Indians can give is something that would benefit them the most, with obviously the cost advantage. In terms of disadvantage, and that's where some of the urban and rural hospitals have a disadvantage, is number one is the connectivity. The second can be communication, because not everywhere you find communication being so smooth and easy. And the third would be some cultural differences. So these are 3 major disadvantages which some may face.
Right. So thanks a lot, Shahid sir, Himanshu sir, Bharat sir, and obviously Dr. Sumit Kapadia sir. So summarizing the things, I am sure that, you know, I always believe, and as to talk to a people, that, you know, people make the city, and city makes the, you know, state, and state make the country. And I think being into the healthcare owners conclave, thanks to Meeta Madam Urig sir and my friends, that they had arranged this thing, and together I think if we'll improvise on whatever the things we had discussed and the kind of insights they had said, we can definitely improvise on that thing. And Honorable Health Minister also talked about it, that they are also trying a lot to bring this, you know, medical tourism, the medical value travel up. So I think together, I'm sure we all can, you know, contribute at a great level to the GDP of a healthcare, a GDP of Indian economy. And this is a responsibility of all of us, the healthcare owners. So thank you all of you. Yeah.
Thank you so much, gentlemen. Thank you so much once again for sharing your thoughts and knowledge. To present the token of gratitude, may I now invite Mr. Vijay Panchal and Mr. Darshan Dave from Vision HVAC to please join us on the stage over here and take a moment and present the mementos to all our panelists and moderator. Now present the token of gratitude to Himanshu Sharma. Marching ahead, we present the memento to Dr. Bharat Modi. We now present the token of gratitude to Shahid Parvez. We would also like to present a token of gratitude to Akhil Dave. Can we have a group picture of all of you together, please?